Hello, this is Andre with Tongue Tales on Monday. Today's tale is about the tongue of a 52 years old female with chief complaints of incontinence. During the day, she feels a sudden urge to go to the bathroom and she can't hold urine. This started happening a year ago, and ever since it has gotten worse. She has 3 to 4 accidents per week. She also cries a lot, and her emotions are a mix of sadness, anger, grief due to her familial situation. She is also a poor sleeper, so she wakes up every night around 1 a.m., then 3 a.m., and then 4 a.m. She mostly wakes up because she worries, but sometimes she also needs to use the restroom. She persistently feels hot and sweaty during the night and during the day. There are some issues with her diet, as she is stress eating, and she gained about 80 pounds in the past 3 years. She feels very gassy, but her bowel movements are regular. Now, let's see what her tongue would tell us. The coating of her tongue looks white and thick. It looks mossy in the center and at the root of the tongue. We can observe how it gets thick, filling in the mid-crack. This is a sign of phlegm dampness in the stomach and the lower burner, because the middle of the tongue is associated with the stomach and the root of the tongue corresponds to the kidneys, bladder, and intestines. A dry, thick, white, and prickly coating covering the entire tongue indicates phlegm-cold stagnation. The fact that it is dry suggests a deficiency of body fluids or yin, making the phlegm more entrenched and difficult to expectorate. We need to remember that there must be some hidden heat in the body, although the tongue coating looks white, which indicates cold. We recognize that the patient often feels hot and sweaty, especially at night, so we suspect yin deficiency. However, such a tongue might be seen in context of dampness and phlegm stagnation, which can manifest as digestive disturbances, metabolic issues, or chronic pain disorders where dampness and stagnation are typical. She gained 80 pounds in the past few years, and she eats sweets that throw off her metabolism and create dampness. Patients with such tongue coating typically have symptoms like fatigue, bloating, and heavy sensations in the body, which she definitely has. The size of this tongue is large and long. A long tongue that is pale and red or pale rules out the diagnosis of heart fire. If the tongue is reddish, it indicates a constitutional weakness of the heart or heart fire. In this case, we don't see any signs of this pathology. However, we can observe curled up edges indicating liver qi stagnation. We can also observe that the edges of the tongue look irregular, which reflects an irregular distribution of qi and blood, where the substances fail to reach and moisten these regions of the tongue. Therefore, rough edges are an indication of qi stagnation as well. Next, we can observe that the tongue's tip is pointy and curls down. We can also observe the tongue's drawn-in edges in the anterior 1/3, indicating heart yin deficiency. The color of this tongue looks pink, pale, and slightly bluish. A pink, pale, and bluish tint occurs when the qi is weak. We cannot move blood, resulting in a pale but also bluish tint. Once again, we can observe a hidden crack in the middle third of the tongue. We can almost not see it because it is filled with mossy white coating, an indication of phlegm dampness in the stomach, which is connected to bad eating habits. We can also observe flat white points on the edges of the tongue, which further confirms liver qi stagnation. However, white nodules in the posterior third of the tongue suggest issues with the lower burner, which includes the kidneys, bladder, and intestines. White color indicates the presence of cold or dampness. When this accumulation stagnates, it forms elevated and bump-like formations in the proximal third of the tongue. Elevation implies an underlying factor of stagnation or accumulation, with the body trying to push out or localize the pathogenic influence. Now, let's put it all together. In this case, the most likely cause of the incontinence is kidney qi deficiency. A thick white coating at the root of the tongue suggests an inability of kidney yang to process fluids, which leads to stagnation. Furthermore, kidney yang does not have full control of the bladder and its ability to hold, leading to accidents. Lower back pain can also be attributed to kidney yang deficiency. Now, her symptoms of waking at night and feeling hot and sweaty are signs of kidney yin deficiency. Nocturia most probably is also attributed to kidney yin deficiency. And this is a condition where there is not enough cooling and nourishing fluids in the body to balance the body's heat. When both kidney yang and yin are deficient, we say that kidney qi is deficient. Deficiency leads to weakening of the bladder control, resulting in incontinence. The ruling formula for this condition is Zhenggui Shen Qi Wan, the kidney qi pill from the golden cabinet. It is a formula that simultaneously propagates kidney yin and yang with a greater emphasis on kidney yang qi. The pointy and curled down tip of the tongue indicates heart yin deficiency, which relates to emotional distress and sleep disturbances. The heart and kidneys have a direct relationship, and the disharmony between the two we call the fire-water imbalance. Kidney water cannot control heart fire, an imbalance that leads to sleep disturbances. If we want to focus on sleep disorders, the ruling formula in this case would be Tian1 Wu Xing Dan, heavenly heavenly emperor's elixir to tonify the heart. Next, the symptoms of emotional distress, such as frequent crying, sadness, anger, grief, irregular sleep times, and significant weight gain, along with the curled up and uneven tongue edges, as well as the presence of these white dots along the sides of the tongue, all suggest she is dealing with liver qi stagnation. While liver qi stagnation is not a direct cause of incontinence, its effects on emotional health, qi distribution, and interaction with other organ systems can indirectly contribute to bladder dysfunction. One way of thinking about this is in terms of Chinese medical idea that liver houses the ethereal soul, Hen, which influences mental and neurological activities. Its imbalance can cause issues like forgetfulness or lack of focus, which are crucial for maintaining bladder control. The ruling formula for this aspect is Jia Wei Xiao Yao San, free and easy wanderer powder plus flavors. It pretty much adds 2 more herbs of cooling nature. A few words should be said about the dry, prickly, mossy tongue coating, weight gain, and craving for sweets. These signs suggest the presence of dampness and phlegm accumulation due to spleen Qi deficiency. The patient should exclude sweets and fast carbohydrates from her diets. And beyond that, spleen Qi deficiency is secondary to liver Qi stagnation, in my opinion, as the tongue does not show typical characteristics such as a swollen tongue with teeth marks. Therefore, using Jia Wei Xiao Yao San is sufficient at this stage. However, we may change our opinion later on and recommend to this patient Liu Junzi Tang 6 Gentleman decoction, which deals with spleen Qi deficiency and phlegm accumulation. This brings us to the end of our presentation on this case. Now, if you have a health issue and would like to know what your tongue tells on you, please follow the link in the description to this video and we will speak about your tongue next. I am Andre with Tongue Tales on Monday, and I will see you next Monday.